Welcome back, everyone. Our midday guests today are from the Lincoln Lancaster County Health Department with Tammy Stevenson and then Christina Hitz as well. Thank you so much for joining us today.
Thank you, Ed.
All right, so the holidays, a lot of times are associated with happiness, but this is a tough time for a lot of people here, and especially with substance abuse at the holiday season. I know with the opioid pandemic or epidemic, this is a problem. What have you seen? I guess Tammy, we'll start with you. What have you seen this time of year, and why does this cause a little extra stress, and maybe people to reach for things that maybe aren't the healthiest coping mechanisms?
Well, it is a difficult time of year, even when our mental health is doing well. Sometimes it's the stress of seeing family members, maybe the stress of not seeing family members, maybe monetary factors come into play, and the ability or the need to perform in a certain way around the holiday season. So all of those things can contribute to stress and anxiety. And then if we choose a different coping mechanism that is not very healthy, then that's where we can see additional problems.
And Christina, you guys are a part of the Opioid Prevention Coalition here in Lincoln, and we did a special actually on this earlier this month about just the opioid uprise here in Lincoln, especially with some of the abuses we've seen and overdose cases we've seen here. Can you kind of just coincide with those problems that you see during the holidays, and why, I guess, is it opioids that are the big issue there?
Well, you asked two questions.
Yes, I did.
So the Opioid Prevention Coalition formed because opioids have been a bigger problem. And so we've been meeting as a coalition with 20 plus organizations in the community since a year ago. And so Tammy Stevenson, the director of the Bridge, has been a stalwart partner with us. And so I don't know that I know the answer to why exactly. I think a lot goes into that. I will tell you that nationally we've seen on the East Coast and the West Coast for years and years opioids becoming a bigger problem, and everything takes a little bit longer to get to the Midwest. And so now potentially that's part of the reason. Certainly I'm not the end all to that answer, and I would offer to Tammy if you have any kind of thoughts on that.
Well, first of all, our number one drug that gets abused is alcohol. Right. In the Midwest, methamphetamine is also still a significant problem. What we're seeing with opioids, though, is an increase. And a lot of that just comes down to availability and what's happening kind of on the supply and demand side of things. So we're not exactly sure why, but usually it just comes up to supply and demand.
Tammy, when you see somebody that is struggling, maybe a loved one or maybe yourself, what are some things you can do to help out?
Well, the big thing is just to talk to somebody and ask for help. Yeah. If it's somebody who is already in treatment or in recovery and you're struggling, go to an AA meeting, go to an NA meeting, talk to your sponsor. If it's something that you're wondering if it's a problem and you've never officially talked to somebody, just reach out, talk to a friend, talk to your healthcare provider, talk to your parents, and just say this is something that you've been struggling with, because it's the system itself and how to get help isn't always the same for everyone. So the key is just to reach out and talk to somebody and say that you're struggling with this and wondering if maybe it's time to talk to somebody or get some help.
Christina, what are some things from resources maybe the health department has to offer?
Sure, perfect, yes. If somebody is struggling, or if you're supporting somebody who's struggling with a substance abuse disorder, we ask you to access our website at lincoln.ne/OD. We have a number of different partner organizations information on that website, as well as where to get free naloxone or Narcan if you do know a loved one struggling with an opioid addiction disorder. That is one of the number one ways to reduce harm and keep people safe through the holidays, even if they're struggling with addiction, is to have naloxone on their person, and you as a loved one have it on your person. And it's free in many different locations across the city and in the county.
Alrighty, awesome. And we're going to have all this information up on our website as well, with links to where we can find some of those resources that you were mentioning there, Christina. That's going to be up at KaleCanTV.com. Tammy, Christina, thank you guys so much for joining us today.
Thank you.
We're going to be right back, everyone, after the break. Stay with us.